Bones provide support for the body and aid in its movement. The place where two or more bones meet is called a joint. Joints may be immovable, slightly movable, or freely movable. A synovial membrane surrounds movable joints. Inside the membrane, synovial fluid lubricates and nourishes joint tissue, such as cartilage. Articular cartilage is a tough, slippery covering on the ends of the bones, which allows smooth joint movement. Joints give the body flexibility, precision of movement, and help in supporting the body's weight. Arthritis is any disorder that affects joints. It can cause pain and inflammation. Osteoarthritis, or degenerative joint disease, is the most common type of arthritis. It's usually seen in older people. The joints most commonly affected are in the hands, knees, hips, and spine. Often the cause of osteoarthritis is unknown, but it may be due to a combination of the following risk factors. A family tendency for this condition. Being overweight. A joint injury such as a fracture. Repetitive strain from activities such as sports. And problems with the bones in a joint not lining up properly. Over many years, these factors can wear away the articular cartilage. The exposed bony surfaces rub together. This, along with the growth of bony projections called bone spurs, causes swelling, pain, and limited movement of the joints. There is no cure for osteoarthritis, but a combination of treatment options control the symptoms. For example, medications can reduce joint inflammation and pain. Common medications include acetaminophen and non-steroidal anti-inflammatory drugs, or NSAIDs. An ice pack may also reduce joint pain. Lifestyle changes, such as resting the affected joint and losing weight if necessary, may help slow down the progression of osteoarthritis. Other lifestyle changes include physical therapy exercises and education to manage osteoarthritis on your own. Physical therapy exercises, along with low-impact exercise such as walking and swimming, increases muscle strength and keeps joints limber. Braces can help with joint support and alignment to reduce joint pain. Another treatment option is the injection of hyaluronic acid into the joint. Hyaluronic acid is a naturally occurring substance in the joint synovial fluid. It helps lubricate the joint and allows the bones to slide over each other more easily. For severe osteoarthritis, a doctor may recommend a surgical procedure, such as joint resurfacing, to remove loose bone or cartilage and bone spurs. Or an osteotomy or bone removal may be recommended to realign deformed joints. In some cases, the arthritic joint may need to be replaced with an artificial joint. For more information, talk to a healthcare provider.
Natural egg membrane, or NEM, contains chondroitin sulfate, which, as we've seen, supports cartilage matrix, provides resistance to compression, and contributes to tensile strength of cartilage, tendons, and ligaments. Hyaluronic acid, which is a major component of cartilage and provides cushioning of synovial fluid. And collagen, which is the basis for joint cartilage, providing tensile strength to the tissues. The use of NEM for joint health is supported by impressive evidence. In 2 studies, supplementation with NEM produced an average of 25% reduction in pain in just 7 days. By the end of the 30-day trial, patients in the first study had an average reduction in pain in more than 72%, and nearly half of these patients reported that they were completely pain-free by the end of the study. In the second study, patients experienced more moderate relief with an average of 30% reduction in pain at the completion of the trial. However, approximately 33% of the participants had their pain levels reduced by more than 50%. NEM is an effective, easy-to-dose, natural supplement proven to significantly reduce pain and stiffness in just 7 days. It provides lasting improvements in joint comfort and flexibility, and also has natural anti-inflammatory properties, reducing pro-inflammatory cytokines. This means that NEM helps to protect against the deterioration of cartilage and may help slow joint degeneration. A daily dose of one 500 mg capsule is recommended.
The natural eggshell membrane, which we believe is a very safe and efficacious alternative to prescription medication and also to other commonly used ingredients for joint and connective tissue disorder and discomfort and pain associated with that. In the clinical trials that have evaluated the natural eggshell membrane, there have been no substantial side effects reported, certainly not anything different than the placebo group.
So you could be taking it ongoing?
Absolutely, and this is a product that has been available for a number of years. There have been over 200 million doses of this product already administered, and that's to humans. And so the reports of side effects are just not there. The issue of side effects are not there, especially when you compare it to prescription drugs or other commonly used treatments. Over-the-counter.
Hi, I'm Dr. Michael Murray, co-author of the Encyclopedia of Natural Medicine. As many people age, they lose cartilage, the shock-absorbing cushion in their joints. As a result, they may experience joint pain and stiffness. While many people use drugs, research shows that anti-inflammatory drugs, whether prescription or over-the-counter, have unwanted side effects and can actually impair joint repair and the manufacture of cartilage. Fortunately, there are effective natural ways to deal with osteoarthritis, with supplements such as glucosamine sulfate being among the most popular. Recent research has found that another useful agent is the inner membrane of eggshells. When taken as a supplement, this membrane is rich in connective tissue components that have the capacity to ease joint pain quickly. In clinical tests, natural eggshell membrane at a dosage of 500 milligrams a day has been shown to improve joint pain, stiffness, and mobility in as little as 7 to 10 days. It also works very well when combined with glucosamine sulfate. NEM natural eggshell membrane from Natural Factors, another fantastic advance in joint care. I'm Dr. Michael Murray. Improve your health. Look to Natural Factors.
NEM is a high-quality ingredient manufactured in NSF-certified GMP facilities using patented eco-friendly processes. So why can't you get the same benefits from eating more eggs? Well, you'd have to eat the membranes from about a dozen eggs to get the same amount that's in just one capsule. And it's worth noting again that the dosage is just one 500 milligram capsule per day. The biggest hurdle in this proprietary technology is extracting the membrane from the shell. Remember, the eggs have already been broken and the whites and yolks have been used in the food industry. After a lot of trial and error, about 10 years worth, ESM Technologies developed a system to heat and vacuum the shells to remove the membrane, with the only byproduct being steam. And that means actually no environmental footprint. Additionally, the raw material is sourced locally and is traceable, renewable, and very sustainable.